Well, good morning, everyone. Today is Monday, May 5th, 2025, Cinco de Mayo. We are here this morning convening as the Board of Social Services. I'm Kristen Stevens, Chair of the Board of County Commissioners. With me are my fellow commissioners, Commissioner Jody Shattuck McNally and Commissioner John Kafalas. We also have our County Manager here, Lorenda Volker. And I will turn things over to Heather O'Hare. There are quite a few people around the table. I'll let them introduce themselves as they speak. We'll welcome everyone.
Good morning. Thank you. Again, Heather O'Hare, Human Services Director. And if you don't mind, I might do introductions now just because it's going to be more dialogue today.
Of course, yeah,
So
please.
we will actually start with Hannah, but you'll get a chance to hear more about Hannah and her background and role a little bit later. Hi. There you go.
Okay. Thank you. Hannah Ditzenberger, Policy Analyst with the Department.
Kayleen Rowley, Business Operations Coordinator.
Jill Mosh, Division Manager.
Vanessa Fuel, Division Manager.
Lori Metz, Division Manager. Hi, I'm Tammy Promis. I'm the Administrative Coordinator.
All right. Thank you.
Thank you. Welcome, everyone.
Before we jump in, any additions to the agenda?
I don't have any. I don't believe we do. Thank you for asking.
Okay. So we are going to start with a preview of a new tool that we've started using in the last couple of months. And I'm going to have Jill Mosh walk through it with you.
Yes, so Jill Mosh, Division Manager for Operations and Organizational Development. So My Friend Ben is a new tool that we launched in late February. And this is a partnership with Gary Community Ventures. So this is a completely free tool to us. It's a customized tool according to county. So there are a couple of other counties that are on this tool. And why, a lot of people ask why My Friend Ben versus just having people apply through BOCC, which is the application portal. We'd like to empower people with information. So this portal actually shows more benefits than what we just offer at Larimer County. So it's countywide, statewide, different benefits, even federal benefits that people can take advantage of. And the time frame to complete this is 6 minutes versus about 45 minutes to complete something through BOCC. So it's quicker, and it's also anonymous. If they don't want to identify themselves, they don't have to, and they can email themselves the results of the tool at the end of the questionnaire as well, so that they can use it in the future. And I mentioned that an example of a program that's not managed by HS, but is a county program is WIC, so Women and Children, Infants and Children. That's also included in here as well. So we'll go to the tool. So hop out to the other link that we did earlier.
Can I ask just a question while you're doing that? Is this a tool that people can use from their home, or this is a tool you guide people through?
They can use it anywhere.
Okay.
So we have cards that have QR codes that we hand out at different community events. We have this on our website in a couple of spaces as well, so they can click on it and go to it and take it anytime.
Wonderful. Commissioner Kafalas.
Thank you, Madam Chair. Good morning, everyone. And just to follow up on that, Jill, so can people actually apply for programs through this, or they still have to use BOCC?
They still have to use BOCC. So I'll show you the results. We pre-filled this with some information, and then we'll show you the results and show you how it works at the end. Yeah.
Thank you.
So the first question before this, actually, there's some things that you have to just check boxes saying that you're allowing them to kind of collect this information. So then you enter in your zip code in your county, and you can go ahead and hit continue. And then it just wants to know about your household. So in this example, there's 5 people in the household. Tells about yourself and each child that's in the household. So first you enter in your own month and your year of birth, and then if you scroll further down, there's a lot of questions it asks you about what you currently have. So for this example, I just selected that I don't know what I have, or I don't have anything. And then keep scrolling down, and it asks you a little bit more about yourself. Are you a student at any college, university, or post-secondary institution? Are you pregnant? Are you blind, visually impaired, disabilities, or any medical or developmental condition? And I selected pregnant on purpose so that I could get some results to show up at the end. And then it asks about your income. So you can enter as much or as little income as you have here. So I just did wages, salaries, and tips every month, about $3,000, because I have 4 kids in the household, so I'm not working a whole lot. So then it's going to go through and ask you just basic information about each child. So we pre-populated 4 children, so we just scroll down, keep scrolling down, and we selected that we just don't know if they have insurance, just to be consistent, so we can continue through these. It asks about those same questions about them, and then at the very end, it asks if they have income, which they're too young, so it's a no. So we'll quickly go through the next 3, so it's all the same thing, just different years. And while I was doing this, I was like, maybe I shouldn't do this many kids, because it takes a while to get through it all. But it helps when looking at the end at the results. So then it asks a little bit about expenses. So do you have expenses in your household? So we outlined that there is rent at $1,500, heating at $200, and then phone at $50, and then dependent care at $1,500, which is grossly underestimated. But just for this purpose, put in $1,500. And then this asks about how much you have in cash, checking, or savings. So this person is not saving anything and doesn't have anything, so 0. And then it asks if you have any current benefits. So if I were to select yes here, which we're not going to, you can select that you're on food benefits or Medicaid or anything like that that shows up. But for this, it just said prefer not to answer. And then it asks you, are you in need of any of the following things? So I selected all of them. So food and groceries, diapers, rent, challenges about my children, concerns about development, family planning, job resources, dental care, and then legal aid as well. So then at the very end, it asks how you heard about it. So for this instance, we're using Test Prospective Partner so that it doesn't show in the dashboard that I'll show you after this is done. So this is an option that you can choose to select or not, which is notify you when new benefits are released, or about other programs or opportunities, or provide feedback to my friend Ben. So we're not going to select that for this. And then it just verifies all the information one more time. So we can scroll down and hit continue. And it's going to gather our results. So it found 14 programs, an estimated monthly savings of $3,450, and then an annual tax credit of about $21,000. So it lists the tax credits first. So these are just all the different tax credits that you might be able to take advantage of based on what your household income is. Colorado Head Start is listed here, as well as the CCAP program, so Child Care Assistance Program. And there was another one that was listed up there earlier, so it updated in that small amount of time. Medicaid, food and nutrition, so the school lunch program also shows up, which is not one of ours. And then housing and utilities, there's a couple of things. So you'll notice that LEAP, the Low Energy Assistance Program, it doesn't show on here, and that's because we're outside of the window for that program. It ends on April 30th. So if you want to scroll back up to SNAP, keep going down a little bit. Right there. So click More Info. So here's where it tells you an estimated value of annually how much you could get from the SNAP program, but then how long it will take to apply. And then there should be, if you scroll down a little bit, it should have a link right here so that you can apply online. So each of the programs that it shows you, it provides you links to each of those programs so that you can apply. And it also provides that key information. So if you scroll down just a little bit more, about what you actually need to provide in the application so that way you can gather all the things that you need ahead of time so that you're prepared to apply. So this is what the portal looks like. Do you have any questions about that before I show you some dashboard information?
Commissioner Shaddock-McNeil.
Thank you. This is really interesting. Forgive me for opening probably a can of worms, but I saw that you said they apply for CCAP on that.
Yeah.
But
Yeah.
we know there's a
Yeah, so we actually, so if go back to results and then click on the CCAP, we can actually work with Gary to customize the information that's included on here. So at the top, it says that we are on an enrollment freeze for CCAP.
Okay. I just think that would be, say I qualify, then come see, there's a thing, just trying to not be deflating. So I'm just curious, but thank you. That was the first thing I thought, so I appreciate that. Thank you.
Go ahead, Commissioner Cavalas.
Thank you. And perhaps you'll get to this in a moment, but how are we marketing this? How do people know about this?
Yep. So we have links on our website. We've outreached to our community partners to let them know that we have this as well. And we're handing out cards that explain what My Friend Ben is on one side, and then information about Larimer County benefits on the other side that has a QR code that takes them to this website. And then social media, really any kind of outreach that we're doing, we're taking My Friend Ben. But then internally, we're using this tool as well.
Thank you, Jill. Just a quick follow-up, and that is, are we doing any type of perhaps targeted outreach? So, for example, older adults who may have different ways of receiving information, are we taking that into consideration? And somehow I have a feeling we are.
Yes.
If you could explain that, please.
Yes, definitely. Go ahead.
This tool has been used by 5, mostly metro counties for the last year or so, and the intent of those 5 metro counties was really to build it out in terms of early childhood resources for families. So we are the first county to use it actually, and think about how we would use it with older adults and their family caregivers. So I'll have Lori share with you how we're working with Gary's team to really build out all of the older adult resources that we have in our community, because that is not a population that this tool has been used on before. So they're expanding it for us. And like Jill said, it's entirely free. It's being funded by their foundation. Their foundation, one of the key pillars is to empower people with information and really help people navigate all of the different resources. So I'll have Lori elaborate on how we're partnering between our teams to build out those resources for different populations.
Of course.
Forgive me, is this available other languages? How do folks whose primary language is something else?
Yes, they're at the top, I believe. Well, at the very beginning, it asks what language you speak, what language you want it in. So you can select at the top or at the very beginning.
Oh, that's interesting. Espérame, entonces, variables.
And so to answer your question about the older adult services, so Erin Alt, our area agency on aging supervisor, is working directly with the Gary Foundation, our contact there, to add those resources in. It's a great platform. It can be updated very quickly, where anytime we print something, by the time we get it back, it's out of date, whether that be, resource or income limits and things like that. So we're really hoping that when people call into the ADRC and they have those more broad benefit questions, we can send them there. And then during our upcoming, this month that we have our resource fair that's coming up, this will have a place there as well, to help people walk through that and see what's available on that side.
Are we still producing the resource guide? And if so, will this information be included?
Mm-hmm. So we're still discussing the resource guide right now, just with different, budget timelines and things like that. So, but yes, this would be something that would, boost that up, because it would be able to be updated immediately. So, and then the different tax credits, things like that. We're also going to include in there specific programs to Larimer County, like our voucher programs and things like that, to this platform.
Oh, did you have something to add?
I was just going to say, the only piece I would add, so our staff that are out in the community, either in someone's home or another location, are provided with a county-issued cell phone. I think this is actually even more user-friendly on the cell phone, as I've tried it on my own. So the staff member sitting there with someone can walk through it, or if they're able to do it on their own phone. And then we are also looking at how do we install kiosks or tablets in each of our welcome centers for people coming into the lobbies too that maybe have not applied. This has been really instrumental in helping lessen the frustration and the challenge for people that are applying. As you saw, it takes, and I think 2 hours is a light estimate for SNAP. So to go through the process to apply, if you don't know if you're going to receive any benefits, is an undue burden to people that are trying to navigate a lot of different challenges. So this is really great to help screen for things also outside of human services. And then the particular links that will then take them to the online portal that varies depending on the benefit, so that they can then apply in a much more expeditious fashion. But it's also screening down the number of applications we're receiving then for people who aren't eligible. So there's been an issue over the last year with as I think you've heard through the Works Allocation Committee, there was a glitch in peak where it was allowing anyone to apply for TANF. Well, the key component for TANF is you have to have a child under the age of 18. We were getting applications for single adults and people who didn't have kids. We still have to work those applications. So there's a benefit on both sides. We're not having to work applications for people that we know aren't eligible, but also it alleviates the frustration for people to do multiple applications in different locations and be able to screen for the information first.
What about like local benefits? Like I'm thinking about like the income qualified utilities through the city of Fort Collins or the grocery rebate. Do those kind of things get included or?
So they can. It's similar to how we're working with the Gary team to build out the older adult services. They will take really any resources that we provide them and update it into our Larimer County profile. There are also Weld County zip codes that are available. So for people who might move into Weld County or leave Larimer after we start working with them, it is a broader tool. So, but to answer your question, we can add any resources that we have locally that they might not already have included. And it was surprisingly fast. We reached out to them right before Christmas, and they had this up and running and ready for us to test the second week of January. So they're really quick. They're very responsive and have been really excited to partner with us. So we're able to update the information and get it turned around really quickly.
That's great, thank you. Any other questions? All right, we'll keep.
I'll turn it back to Jill. She's going to walk through the other really significant benefit of this is it also. Sorry. It provides data on who's searching for what from what area of the county so that then we can tailor other strategies that we have underway.
Yeah, so we took screenshots of the dashboard, which is interactive and real time. So we logged in, it was around April 20th that we logged in, and it shows about a month's, well, this shows the last 7 days. So the last 7 days, during this time, how many people used the tool, and then outbound links that were clicked by each person, and it provides, it's really small up there, but it provides the number of clicks for each specific one. So tax credits was the highest with 8 clicks. And then it shows you a conversion funnel that shows total number of users, how many started the screener after they went there. So maybe they went and they decided not to complete the screening. And then how many saw results page, so 104, and then how many clicked a link afterwards turns into 30. So that's kind of a cool stat that we can see there too. Additionally, we can see breakdown information about the people that entered in information into the screener itself. So here you'll see that the total annual eligible benefits is over $4 million. That was a result of the screens. Median annual benefits is about $9,500. And then the median monthly benefits is $791. And then you can see referral sources. So our main referral source right now is the Larimer County website with 195 links from there. And then partner codes are things that we provide our partners, obviously, so that people can enter in that that's where they came from and that's where they learned about My Friend Ben from. And then the last piece of the dashboard that we'll show you here is it shows you just a snippet. As long as you say you are willing to share this information, it shows a snippet of what people look like as far as their demographics that come and fill out the screener. So here you can see some people didn't fill out their income at all, so that's why it says no data. And then about 14% are the $15,000 to $30,000 level. So It also shows you household assets and then the household size of those that filled out the screener as well. So about 38% said they were just a one-person household versus 16% that it's four. So preferred language by and far is English at 97.2% with the rest being Spanish. So just a really neat overview of the people that are coming to this website so that we can use that to then target back to our community based on the information that's showed here. And there is actually one more page. And this is self-reported benefit status. So that one box that we selected that said we prefer not to answer. So some people do fill that out. And so you can see here that 59 people that took the screening test or the survey have SNAP. So, and then it outlines all the other programs that they have as well, or that they selected that they had. So that's just a high-level overview of what the dashboard looks like. And that was something that was included with this. We didn't have to ask for it separate, and it came about a month after they set up the website.
Questions or comments? Commissioner Shattuck McNally.
Thank you, Madam Chair. Excuse me, this is really very interesting and exciting to see. I'm curious, and maybe you showed this, but I'm wondering how we track different areas of the county so that to kind of monitor that and seeing where that goes. And then also if we see, like, we know certain areas might be needing more, if we need to do outreach to kind of encourage people to fill this out. And let's see some of our rural communities, I'm just wondering if that's something we would use that data to do targeted outreach to get folks to.
Ideally, yes. We didn't include a screenshot here, so I'm not sure if they include the zip code, but I would imagine that they could pull it if it's not in there, because they do ask for your zip code in the beginning.
And would that be something that you're looking to track and maybe see if other areas maybe aren't having a lot of people at least attempting this, that maybe you could?
Yeah, do more outreach in that area, definitely.
Thank you.
Any other questions or comments? Commissioner Cavallis?
Thank you. It's a really good point from Commissioner Shattuck McNally about, are we able to discern the people that complete the survey, where they're coming from? Is that what you said?
Yes, by zip code.
So that's important, and especially in rural areas where they often feel like they're being ignored.
Right.
And then to perhaps build on what Commissioner Kristen said, I think it's an important point that we look at local resources, and I think you took notes about that. But I'm wondering, you referenced nonprofits and all the rest, but what about other jurisdictions? You know, for example, the city of Fort Collins says neighborhood resources. Is there engagement with them, or some of the other institutions like Colorado State University or Front Range Community College? Is that kind of interaction happening so students can have access to this information, or somebody who goes to the Leaper Senior Center up in Wellington, Wellington can provide some of this information as well.
Yeah, our long-term goal is to go further into depth into some of these areas and reach out to partners. This time we just wanted to launch it and get it up and going and check numbers and see how it was working and show it to you all. And then our next step is to go deeper with partners.
One last question. Yeah. I think one last question, and appreciate this looks like a interesting and fun tool. We should probably try it. And that is, I noticed on this slide here, self-reported benefits, et cetera. For example, earned income tax credit, both the federal and the state. Not a whole lot of folks are utilizing that, which can be a big deal. So how would that inform and change how we do outreach to folks about, EITC?
I think that's exactly what we're hoping to
Okay.
use this data for. So something like the earned income tax credit is a little bit outside of our lane, but we do often get outreach from different state offices who reach out to us and say, would you mind putting information in your lobby? Or would you mind helping us to share information that's been gathered by other partners, either locally or at the state? And when you walk through the tool, I don't know if you noticed, there's a long-term benefits tab and a short-term benefits tab. And so you can click on each of those, and then it gives you more information. So for the child tax credit, if you have kids in your household, then that will come up on your list, and then you can click through for more information too. But we have been sharing information in our lobbies or through staff and their connections directly with clients. And when we get into our last presentation, giving you an update on our community navigator team. This data can also help us then on where we send that team to do more of the outreach in person, and information and resources that they take with them too, depending on the location that they're going for that day or that week, as we continue to build out that strategy as well.
Thank you. I appreciate that, and certainly appreciate the comment of it's a little bit outside of our lane, but in these days we're constantly trying to understand what actually is our lane. So I offer that as food for thought. But I think another important point I wish to make is that, there are certain things like tax credits that you get the biggest bang for the buck, and it's not necessarily a government program or service. And we know that EITC has bipartisan support. It's been around the federal and in the state, of course. And so it seems to me, in terms of prioritizing and in light of all the uncertainties, paying maybe even closer attention to tools like that can really help folks, families put more money in their pockets. That would be an important way of, if we have to prioritize things, prioritizing things like that perhaps.
And I just meant to say, when it falls outside of our lane, we're not often able to develop the marketing material ourselves, but we certainly can find out who owns it and bring it in and share it in sort of the package that we offer. Yeah.
Yeah, I'll just say thank you. This is a great tool. Thanks to Gary and everyone who was involved with creating it. I mean, I guess you could add things. It's nice to be able to add things, and also it's probably good at some point for people to talk to someone, right? And really find out about their specific situation, because we know there's a lot of nonprofits that do neighbor to neighbor, and you could add things that weren't necessarily valuable. So is there something that says at the end, please contact, if you have more questions, or I don't know, is there some kind of thing that says,
There is an option to download your results, so you can save them, and it'll show the resource link.
Okay.
And then at the very bottom, it says, can't find what you need, and then it says more help, and there's 211, Family Resource Center Association, and then our County Human
Yeah,
Services.
just because I think about, there's, if you have a child that's disabled, and you can, so there's so many different, factors and services in the community, and of course, all of those, but that's good but I think this is such a really great, way, a easy point of entry for people who are curious or wondering or, need that information. And I love the application times, because that is, if you've ever filled out any government form, that am I going to need to sit down and have a cup of coffee with this, or am I going to be able to punch this out? Thinking of FAFSA and all the kind of forms that I filled out over the years. So I think that's really, really helpful too. Are they all different applications? That's my question. It's so when I say this one's 45 minutes, this one's 2 hours, I mean, there's no sort of general way to apply for a lot of these things, or no? Of course not. Not your fault. I mean, yeah.
The Peak portal is probably the most comprehensive of all of them, and that includes Medicaid, food assistance, child care assistance, the other cash programs that fall under our umbrella. But most of them are separate, unfortunately. And the other piece you can actually see right here that we didn't mention, it does also it walks you through the citizenship status questions as well. And so if you don't have citizenship, you click that option, and it provides different resources to you based on what you might still be eligible for.
That's great. Commissioner Shannon McNally.
Thank you, Madam Chair. back to the dashboard with my friend Ben with the household size. Looking at that, we have 38% just single folks or one-person households. And I was, I've heard from two different sources, whether they're exactly the subject matter expert on that. They are subject matter experts, but I'm hearing this. I don't know if this is in the budget or the state budget, but they are looking to reduce, I heard reduce benefits from single adults or people applying for single adults for benefits. So seeing that, and I'm not sure if that's at a federal level or state level, but I'm hearing this more than not recently. And seeing that that's 38% of people applying for benefits, whether they're older adults or younger adults. I don't know if you've heard that. Would that be something we would need to, how we would, I don't know how you, basically we'd have to tell a whole subgroup of people that they don't have as many benefits. So I'm just curious if you've heard that. How could we be proactive about that? And just curious, because I've heard it probably in the last 2 weeks, 2 or 3 times now.
So I'm not aware of anything changing at the state level with the legislature wrapping up this Thursday. We haven't seen anything that shifts that for Colorado, but the changes that might come in the next 6 months at the federal level, I think everything is still up in the air at this point. So we certainly would watch and are watching for all of those changes. But with that population in particular, I think our partnership with Economic and Workforce Development Department is likely really key. And so Vanessa is very connected to Mark Johnston's team. Those might be individuals that need employment, that are searching for jobs. And so how we utilize this information to then build even more partnerships based on what this tells us. That's why we're really hoping to be able to get this in much wider use. Like Jill said, we launched this towards the end of February, so it's still very new. I have walked through it with my human and economic health peers so that they're aware of it. But I think it's those data points that are going to help us then determine, do we have a gap in our partnerships or resources that we need to look to address and then build from there.
Great. I'm like I said, I'm not sure. I've just heard this. It could be next year in the state, or whether this is a federal thing, because people have been just talking to other folks in this space who are, this is their kind of passion area. And so I just was curious, but it sounds like this could be a useful tool helping us kind of addressing that. Thank you for your answer. I appreciate it.
So how can we help? We go out in the community. I think there was a reference to little cards or something. How do we get some of those little cards?
We can inter-office some to you so that you have them.
Inter-office? Oh, yeah, we have something called inter-office.
Yeah, we can get some.
Mail.
Yeah.
It's,
Either that or I'll drop them off, one of the two.
It's okay.
We can provide you the cards so that when you're out doing your community meetings, you have them. And I think we will also connect with Michelle Bird to see, I think there likely are several places that this could live on the website, and how do we make it so that it's easy to find if you don't have that QR code handy. So we can touch base with Michelle again now that we worked with her before we had it implemented. So we'll loop back to her and see how we want to market this even broader.
Might be helpful to do some social media posts about this tool. And also, I could use cards before Thursday, so I'll be in Red Feather on Thursday and LaPorte on Saturday.
Great. We will get them to you.
Thanks.
thank you. All right. Well, thank you. That was really great to learn about that tool. Appreciate that.
And as we continue to build it out and have more data too, we can bring that back to you and give you updates.
Wonderful.
All right, we are going to shift gears. Wanted to provide an update as the legislative session comes to a close. But before I dig into that, I wanted to give Hannah an opportunity to just share more about her background. She's been with us a little short of a month, hit the ground running for sure. But I wanted to give her a chance to tell you more about herself, and then we will dig into the bills and updates from the budget.
Yes, thanks for having me. As Heather mentioned, my name is Hannah Ditzenberger, and I'm the policy analyst for the department. I previously worked for the National Conference of State Legislatures, where I provided human services policy analysis and research to state legislators around the country. I also have some experience in social science research, and I also worked in communications for a CASA GAL program that was operated under local government in Indiana. So I'm really excited to be working for a county again and just kind of taking this broad view of human services policy that I have and being able to use it in support of Larimer County. I'm a graduate of CSU too, so just have ties to Larimer.
Welcome, Hannah. It's really nice to meet you, and thanks for your work, and we're looking forward to having someone help us dissect what happened, so thank you.
So I would say there are 4 different buckets that Hannah and I have been working on as she joins us in this role. The legislative process, so certainly helping us track and dig into the human services legislation, in particular the budget items, really tracking what happens through the JBC and the governor's budget. The second piece are our state rulemaking boards, so being able to provide Commissioner Kafalis in particular with the feedback from Larimer County's staff on the things that go through the State Board of Human Services. But Hannah was also instrumental last week in helping to support the team through the Medicaid county administrative rules that are significantly changing. And Vanessa and I and David Aero all testified before Director Bimsteffer on those. But Hannah she drafted the letter and helped us then pull together all the details around the Medicaid rules, early childhood rule promulgation. But then the other pieces, the Works Allocation Committee, so Commissioner Stevens, Hannah is digging very far into the details, doing legislative review around TANF legislation, temporary assistance for needy families, the MOU and the other policies that we're required to do, sifting through federal requirements to see if we've added on our own state requirements, and then also looking at the legal review from the county attorney's office, pulling that all together so that we can develop a plan if we need to shift based on expenditures there. So the support to you in the Works Allocation Committee. And then helping us to really build more understanding amongst staff about how impactful policy and legislation is to our work. There are a few of us that are policy geeks. I never thought that I would refer to myself in that way. It was not an area that I understood early on in my career or had really any interest in. And thankful to Laura Walker that she had me take on the legislative work when I was the deputy director. But I think helping to build more understanding amongst staff of why we spend so much time and energy towards policy and legislation and how it really does drive everything we do day in and day out is something that I've asked Hannah to help us think about, how we build more understanding amongst staff so that it's not as heavy of a lift during the legislative session or during rule promulgation. So tying all of those things together and then helping us become more and more efficient year over year towards our legislative process. There's got to be a better way to do it every year so that we are not as reactionary and trying to just make it more efficient, knowing that it is a heavy load, that we have very little control over the timing or the intensity. So I'm just really excited to have Hannah join us and have the experience that she does. She's been fantastic in the first couple of weeks.
Great. Well, yeah, we're excited. Go ahead, Commissioner Kafalis.
Thank you. What role will Hannah have regarding your work with the Colorado Human Services Directors Association? How will she support you so that there's a little bit of delegation of responsibilities?
So the first delegation of responsibilities, I have told the association that my time is coming to a close as the legislative chair. 9 years is enough. So I am working with the association towards that. But I will continue to be involved, but Hannah really is We've connected her. There are probably 8 to 10 counties that have a similar role. And so those connections and making sure to build those relationships, most of them are in the metro counties. So Hannah will continue to be very involved in the legislative committee for the Human Service Directors Association, and then helping to support us as a county to both CCI and CCAT, regardless of my role. But I have informed the association that I hope to have maybe 1 more year as the legislative chair and have somebody take it over.
The big shoes to fill.
Thank you.
All right.
Okay, so we will go through the bills and other budget items that are coming out of the session this year. So these, I believe every single one of these bills, actually with the exception of Senate Bill 294, are bills that you took positions on. These were really the 5 that we have been tracking to this level of detail. So House Bill 251097, this was really to implement much more prescriptive statute on when a child or youth in foster care goes to a different placement or returns home, what type of plan is put into place, and really making the process much more prescriptive. There was a lot of work that went into this one through CCI because it was too prescriptive. And actually the parents' attorneys, the attorneys that represent parents in child welfare, actually had some issues with this one because they felt it actually violated the constitutional rights of the parents. Because one of the significant requirements is that we would have to put a transition plan into place when a child was leaving foster care to go home. So there were significant pieces that we worked through. In the end, the bill really landed in the best place we could have hoped for, was to look at rule promulgation. So there are pieces that will come through the State Board of Human Services, but it was it removed a lot of the language specific to emergency transitions or children going home, and then required technical assistance from the State Department out to counties on how best to do this within best practices. So a lot of changes, and much of the bill was actually overhauled completely from how it was introduced. The next one I'll go to is actually 1271. So these 2 bills were very closely tied together because they had the same sponsors. And so strategically, as we worked through CCI, we were working on both in tandem, so that because both together had significant fiscal impact. So House Bill 1271 is federal benefits for foster youth. So there's been a lot of conversation about this concept for the last 5 years. And it was to require county departments of human services through child welfare to screen every child that came to us through child welfare for survivor benefits through Social Security for when a parent dies, developmental or disability benefits through Social Security, but it also included railroad benefits and veteran service benefits. The reason this one was so challenging is there is a moral issue, is probably the best way to frame it, in that federally, the federal requirements allow counties to retain part of the Social Security when a child receives Social Security. Towards the cost of foster care. Foster care is incredibly expensive, and so we've had guidance up until really the last year that said you are able to, and in most cases you should, retain a portion of the Social Security benefits and then contribute that towards the foster care expense. The reason I say there's a moral issue is that then we have a population of children with disabilities who are paying for part of their foster care, but no other child in foster care is paying for their care. So it just was not a good philosophical practice, even though federally it's allowed and was encouraged. So the bill, as it was introduced, would be to require us to screen and then apply for Social Security for all of the children that would fall eligible under those 4 really broad Social Security or retirement benefits. And then the other piece that was added as it was introduced is that we could no longer keep any portion of the benefits towards their cost of care. We would have to set up a separate account for the youth and then give that funding to the child when they left care or to their caregiver. So this bill also significantly changed, and this is one of the best examples. My entire 10 years of being this involved in legislation where the county's costs were actually incorporated in the fiscal note. We worked across counties. Our team, Adams County, Denver, and Boulder really analyzed how much we are using Social Security benefits today towards the cost of care, but also the loss of the federal foster care funding if this were to be implemented as it was drafted. And it was several $million. And so through Kevin Neiman as the contract lobbyist for CCI, we were able to then meet with the legislative analyst that was drafting the fiscal note. And she included that backfill as part of the required fiscal note. So when the initial fiscal note came out, I think it estimated $10 million in backfill for the loss of the foster care funding. So we were able to then use that information to whittle this down, and it is only required now for survivor benefits. So if a child has a parent die, then we will screen them for the Social Security benefits and apply and figure out what they might receive, and then we'll set that funding aside in a trust account, which for us, that's how we do it anyways. For those benefits, we open up trust accounts for those kids. And then it outlines a process to explore the policies and procedures to figure out how to move on the other buckets of benefits. So that helped to reduce the funding. I think it dropped down to 1.8 million. And then there was a lot of work through the JBC where they set funding aside should this bill move forward. So this bill was funded for the fiscal note impact that we were able to get included. And then we have asked the Child Welfare Allocation Committee to develop an expenditure report to make sure that we're not spending more than the fiscal note analyzed, to be able to track that in future years. So both 1097 and 1271 were funded as best as we could have hoped for, and are moving forward, and both have a 2027, July of 2027 implementation date. So we were also able to really move out the implementation date to allow for enough time for the policies to be developed and the rules to go through the process. Any questions on those two? That was a lot of information before I switch.
I don't think so, but just kudos to you for getting that, those funded and for making folks understand what the cost to counties would be. I think that really is a win. We need to do that all the time. I mean, not just in your world, but like, you know, it's important with all these bills to be able to do that and really accurately capture those costs so that counties can understand what their impact is. So that's great.
Thank you. Yes. So House Bill 251146, there was a lot of negotiation behind the scenes on that, but it did move forward in increasing the detention beds based on the utilization and then also the funding. And they were able to also secure some diversionary services through that to try to make sure that kids that are going into detention are really the kids who should be in detention, and that we're not seeing kids go in that don't really need that level of care. House Bill 251279, so that's the Colorado Works reporting bill that came out of, I think, the Children's Campaign were the proponents of this one. And this was really to increase transparency and technical reporting around how TANF funds are being used in Colorado. So not only our expenditures at the county level, but also at the state level, so that there is quarterly reporting on how the dollars are being spent and are they being spent in the areas and categories where we should be spending them. So parallel to this, there's a work group that has been created because there are a whole lot of codes in the financial system that we can use to report, but there's been no guidance or policies from the State Department on how they want us to report to make sure that it's also consistent. So we have someone from our accounting team that's participating in that so that there's consistency in how the data is being reported so that then we can, and that information comes back to the Works Allocation Committee, those quarterly reports, so that then that committee can make some decisions and be able to look at the full picture for TANF in Colorado. The last one, Senate Bill 25-294. So this was an issue that came to light about halfway through session in that in 2018, Healthcare Policy and Financing made a statutory change that would move the child welfare residential placements under the Medicaid capitation. And then it was stalled through COVID, and it wasn't until about halfway through session that we realized that they planned to move forward with full implementation July 1st. So the issue with this one is that it would have the regional accountable entities, the RAIs, who have been contracted to basically do utilization management for HCPF under Medicaid. It would move the oversight to the RAIs on when Medicaid would pay for child welfare residential placement, and it would require those placements to only be paid through Medicaid if they meet medical necessity. Medical necessity continues to be this great big black box that nobody knows how it's defined or decided, but often kids are found not to be medically necessary, and so Medicaid doesn't pay, and then child welfare has to pay. So we're talking sometimes $8,000 a day for one child. And so to move this to the RAIs, where the RAIs are, they are the ones responsible for reducing costs to Medicaid. So then to move this decision-making to them, it seemed like a significant conflict of interest. So this was a late JBC bill that just passed that requires HCPF to work with residential facilities, service providers, and counties to develop all of the policies and procedures of how this would work, how it would be decided, who pays what, and then full implementation will happen next July. So Thad Paul from our team, Hannah has joined one of the meetings. There is a lot of work happening to map out the process and then use that to write the policies and procedures that are due by December 31st. So much more to come on this, but it at least stalled the implementation of this really significant change for a year. And then the Works Allocation Committee, we have the long list of recommendations that went to the JBC. The JBC decided not to take action on those to slow TANF spending on statewide programs. So that will be coming back to the committee to decide what to do with that list in the next year. Switching over to the budget items on the right, in a really difficult state budget year, this was probably the best budget year for human services that I've seen in many, many years. The Child Care Assistance Program, CCAP, received $15 million in supplemental funding for this year, and then an additional $10 million starting in 26 and beyond. 25, July 25 and beyond, an additional $10 million. But the catch on that is that the county match percentage is also going to go up starting in July. But overall, there was $25 million dedicated to the CCAP program. Food assistance, SNAP, county administration, $4 million of new funding was added to counties after the Senate Bill 22-235, which looked at the workload and the funding model. So that's specific to food administration. And then Medicaid administration, $21 million coming to counties to administer Medicaid, again from that funding model. So in total, county administration that we interweave together because the staff are determining eligibility on those programs at one time, $25 million being infused into county budgets starting in July. And then, unfortunately, child welfare is remaining flat, even though it is projected to be $25 million overspent as a state. But the state had put forward a $5 million reduction to core services that did not move forward. The JBC denied that in the governor's budget. So it will truly remain flat, but thankfully we won't see that cut. Questions on this? I know in the next presentation, we'll give an update on where the CCAP freeze is and give you that update, but any questions on legislative?
Any legislative questions? Commissioner Shattuck McNally.
So it sounds like a lot of your efforts and work really helped to have you said one of the better years for human services in a lot of these areas. So is that something we're going to need to keep the full court press on, to use a sports analogy, going into the next year, which we know is going to be even a little bit more tumultuous. So looking out, even a year or two, what is that? I don't know what you guys have been forecasting and how much do we need to keep the pressure on? Just curious.
So I would say one of the primary reasons we had such a significant outcome from the JBC this year really was Senator Kirkmeyer. My counterpart from Weld, Jamie Ulrich, and I met with Senator Kirkmeyer every Monday morning at 8. And we were walking through all of the JBC documents that they were getting for all of the meetings to come that next week, and really honing in on the county impacts. And then that would be taken into the briefings and the hearings. I do think, though, that it is going to need continued pressure at the state level, but even more so at the federal level. We're watching, and Hannah's helping us track all of the federal developments, but it is very likely that there will be significant cuts to TANF, food assistance, Medicaid, and potentially also Older Americans Act and child welfare. And so the issue is that they will cut the federal funding, but obviously the level of need is not going to decrease and the workload is not going to decrease. In some of the changes we've heard, the workload would actually significantly increase with fewer resources to do it. So I do think the federal pressure is going to be crucial, and we won't know what that looks like probably for a couple more months.
Thank you. I know you don't have a crystal ball, but we can kind of see the horizon and what's we think is on the horizon. You mentioned Older Adults Act, which is very disconcerting to me. I've been bracing, but also I had a lot of older adults show up at my community conversation, my Common Grounds this weekend, and luckily I didn't bring enough copies of the resource guide, but I at least got a couple they're all going to share. And I showed them some things, but they asked me a question, and then you just brought this up, and I'm glad that kind of jogged my memory. And these are all single women, have been widowed or whatever, so they're really on their own. But as we have changes to Social Security local offices and be able to access folks, I know it's not our lane, but how can we support, or what should we share, and how can we help some of these folks with their some of their questions? Like, I walked them through the property tax bill and showed them our Budget Explorer, and boy, their eyes got big. I had no idea. I thought this was all for the county. You mean the county only gets this, and I didn't know about this. And so I'm just wondering, there can be a lot of questions, a lot of older adults that maybe, like my mother, are not tech savvy, and so I'm wondering how I know it's maybe not in our lane, but how can we help support that, since we're looking at some constraints coming forward?
So if it is Social Security related, they absolutely should call us. So I don't know if you all will recall the Aid to the Needy and Disabled Navigator Program that we received funding from the State Department of Human Services. So that program was disbanded and moved by the governor to the Colorado Opportunities for Individuals with Disabilities office. They stood up a new office at the state level. We have continued to fund a case manager that is helping people navigate Social Security. And the benefit, if you will, of losing that funding is we can be much more flexible in what she works on. She was very specific to only helping navigate one type of Social Security application, but she's been able to develop relationships with the local office, and we're looking at how we expand that, knowing that the requirements from House Bill 1271 will come. Even though that's focused on child welfare, it's the same Social Security office and the same staff that we need to leverage those relationships with. So they should absolutely call us, the ADRC number. They call the Aging and Disability Resource Center hotline. We can get them connected. We have seen slowing in the Social Security office, and we've heard that other Social Security offices across Colorado are being closed. Ours in Fort Collins is not, as far as we know, but they have shifted processes to want more things electronically, but you still have to come in person to sign. So it is hard to navigate, but we do have a dedicated staff person that they should get connected to help them.
Great, I appreciate that information. Thank you.
Anything else on this topic? Go ahead, Commissioner Kafalos.
Thank you. I have a couple of questions, perhaps two, regarding the Colorado Child Care Assistance Program. The supplemental appropriations are on top of what is currently funded by the state, which is, I think, on the order of about 34 million. But
Yes.
you can make sure that number is accurate. Related to that and related to the CCAP program, it is good news what you shared. And will this additional funding get us from serving 9% of the families to 10%? And related to that, I guess there's a couple of questions squeezed in here. Forgive me. What kinds of discussions are occurring about what it would take to get us to serving 90% or close to 100% of the kids and families that could benefit from CCAP, from some level of cost-sharing, subsidized childcare, so people can engage in the workforce? So that's my CCAP bundle of questions. I count that as one question.
So the 15 million, we'll call it 25 million for the 15 this year and the 10 that starts in July and continues ongoing. That is so it does not cover the entire spending that we have today. The 15 million is close to what counties are spending over right now, to serve, again, only 8 to 9% of the eligible population. The federal requirements then come again August 1st of 26, where the requirements ramp up significantly. So the State Department has estimated that we need $100 million just to serve the same 9% we're serving today with the new federal requirements coming. So if we don't figure out how to stop the requirements, which I don't think is the State Department's strategy, even though the new administration is very likely not to hold us accountable to the new requirements. We can have more offline conversation about strategically what we might do with that. But the State Department has estimated that if we don't find $100 million between now and August of 2026, then we will serve 4% of the eligible population just within the current pot of funding we have.
So what you're describing suggests that in our lifetime, we'll never be able to serve closer to 100% of the kids that could benefit the families.
So we are pushing the State Department through our Human Service Directors Association, and I'm now the chair of the Rule Promulgation Committee for the Department of Early Childhood. So we're trying to push through that committee as well, that we need to set a goal. We need to say, okay, our goal is to serve 40% or 50% of the eligible population, and then how do we start to analyze the amount of money we need to get there? But we don't have a goal. So it feels like we're constantly just throwing a dart in the dark and then seeing what county budgets come out like. So they've retained a consultant to help do some of that strategic planning. So because we heard very loud and clear from Senator Bridges and others on the JBC that we need to come with a goal of some sort. We can't just say we're underfunded, but we didn't really have a specific dollar amount to be able to ask for either. So that work is underway, but it will probably take the next year or so.
Thank you. May I just continue a tiny bit more dialogue? Thank you, Heather O'Hare. And as part of that strategic planning, and I'm a little bit surprised that all these years we haven't really set a goal to say we need to get to 50%, or, I mean, we have that with underutilization of SNAP, for example, food assistance. But regarding that, is part of the strategic planning also looking at how can we be even more creative than we strive to be, looking at regional approaches, in terms of funding issues, not just relying on the state, but perhaps regional approaches like is being discussed, considered, for example, in Larimer County and what has occurred in other parts of the state. Is that part of the discussion?
It is part of the discussion. The other piece of the discussion, though, that I have had conversations with Dr. Roy just in the last week or so, Colorado has to figure out how to evaluate from an academic research perspective. I think we have far overvalued quality for the sake of balancing it to make sure we have enough spots. So the UPK requirements are actually reducing the number of kids in a classroom from 10 to 8. So that's 2 spots for every classroom that serves 4-year-olds. The number of kids who won't be able to access UPK is going to be in the hundreds, potentially the thousands, but we're saying it's better quality. Yes, it's better quality, but what kind of quality does that family have at home if their parents can't work, right? So how do we need to research, and I think probably require in legislation a research study to find a better balance.
Perhaps this would be a good offline conversation with our new policy analyst person. I have a couple more thoughts, but I'll let those go. I would like to shift before we go to the next, regarding the administrative appropriations, the additional funds. How will that help us address workload issues and timeliness of processing applications, since we have not always been successful at how quickly we turn around some of these, much credit to the income eligibility technicians and all of those folks that determine eligibility. I mean, it's just an amazing feat that they do. So how will it help address workload and also timeliness of processing applications?
Do you mind if I actually get to that? Because it is in the next presentation.
Actually, I do not mind if that will help move us along. And I bet
We
the
will
chair
cover that on
the chair
the-
will not mind
Perfect,
either.
yeah, let's
Okey-doke.
continue and we'll
We
get
will
those
cover that
questions.
on that slide.
Okay.
That is part of it. Okay, so this is our fiscal update that we do before you on a very regular basis, but we have married it with the department activity report so that you can see side by side the volume of work and the finances. And then I've also added some overarching detail for you on what drives our allocations. We haven't done that in several years, so we've added additional detail on some slides so that you have a sense of how is it determined how much child welfare or adult protective funding we get. So that data is included in here too. Again, just a reminder for anyone listening, I know you all know this very well, but we have 3 different fiscal years that we're navigating across. Most of it falls within the state fiscal year for our state allocations, and then figuring out how that crosses over the county fiscal year. 82% of our budget comes from state and federal funding, and then about 17.5% comes from our mill levy, the county match. And so you'll see it called match on the slides to follow. In some programs, it's called a maintenance of effort, just really semantics at the federal level. And then I've also included in here just updates on our TANF reserves as that impacts our Colorado Works TANF program as well. So here, just at a high level, our total budget is a little over 62 million. And so the breakdown, we have 18 different funding allocations that make up that 62 million. And so here are the biggest, the most prominent allocations by number here. So child welfare has multiple different smaller pots of funding that rolls up into that, but child welfare is our largest at almost 27 million. And then county administration is SNAP, food assistance, and Medicaid rolled together, but we do have to track it separate. So just included this here so that you can see on one slide by the allocations. So now we'll jump into the different allocations, again, with the workload information next to it. So I'll run through the fiscal data, and then Lori's going to walk us through the programmatic data in the visuals. So adult protective services, we have two allocations that go into our adult protective services or APS budget. By and large, it is the administrative portion of the allocation. We receive about $32,000 for services. So the remaining 1.4 million and change is for administration. And it is very prescriptive then on what we're able to spend the funding on. So for that $1.4 million budget, 290,000 or so comes from our county match. And then, like I said, about 32,000 in services. So the services can only be spent on open APS cases getting a direct service. So a lot of times it is actually, if we have an individual who struggles with hoarding behavior, we hire a contractor to come in and help clean up the home so that it's safe while we continue to wrap around other services. So it is a direct service to that APS client. It's actually quite restrictive in how we can spend the funding. The other double-edged sword to that is that when the services pot of funding is underspent across the state, they use that to cover the overspending in the administrative pot. So there is constantly money that is moved back and forth, while this allocation has stayed very flat for several years. And really, we struggle and are frustrated by a lack of strategic priorities from the state team in helping to request the budget that is needed for this growing population. So we are projected to be about $515,000 overspent in our administrative line, and that will be covered from our human services fund balance. And that is really driven, last year we were about half that overspent. That's really driven by the internal costs increasing that the county has for doing business, personnel increases, but also the increase in just being able to provide the business, IT equipment, facilities, all of those things. As the county sees our costs go up, that's what drives that for the APS team. So I'll let Lori walk through the caseload data on the next couple of slides.
Sure. So you'll see, and they are actually voting on the APS allocation formula this week. So we'll know a little bit more about that probably Thursday or Friday at this point. So Heather mentioned things have been largely flat on that budgetary side. So on this slide here, you'll see that the total number of our referrals is up slightly. When I chatted with our APS managers, they are making more of an effort. In the first quarter of this year, they've done a lot of community training about, when in doubt, make the report. Don't try to decide if it's going to be screened in or not. That's our role. So they're attributing kind of this increase in referrals when the slight decrease in the number of referrals assigned to that outreach and community effort. So that's that slide. Okay, now I have to move mine. So as you can see, caregiver neglect and self-neglect continue to be our largest reported mistreatment categories. We do kind of see those things go hand in hand pretty regularly in cases, when people are, spouses are living together that, one is maybe assigned as a caregiver, but the other individual maybe won't allow them to do care. So we kind of have those two things that come in together. Something kind of to note here is on the caregiver slide, is that younger age group. We are starting to see a bit of an increase there of they are reported as our, at-risk adult, and the allegation is caregiver neglect. So just something to kind of keep an eye on. We don't have anything to attribute it to, but just something of note on this slide. And just always know that there can be more than one mistreatment category per referral. So that's why it looks like a lot in relation to the referral slide from the one before. Okay. Housing, need for medical insurance, in-home services are always kind of those top ones in our service and case planning categories. And so you'll see there. And this also, there can be several chosen for each case. So the numbers are a little, this graph isn't one that I love the most in this presentation, because I don't feel like it's a super great representation, because so many can be chosen for each category. Okay, and I think I have one more. Okay, so here's to the Office on Aging. Do you want to do the fiscal piece first?
Yeah, I'll do, so for the Office on Aging, while there have not been cuts at the federal level, the state is not giving us, so at the state level, for the Office on Aging, funding remained flat. But the State Department is anticipating, and there is a lot of unknown around what's going to happen in the federal budget. So they are only releasing 75% of our allocation to us. So we are budgeting to 75%, which means we will have to make some cuts to our grantee contracts to providers by 25%, and then we'll see what happens with the federal budget, and then we'll reassess this fall. So if there aren't cuts made to the Older Americans Act at the federal level, then the state has said, we will give you a secondary allocation letter for the remaining 25%. If there are cuts, then we will just ask you to live within your 75% of the allocation you've already gotten. So we are making those adjustments now. This one is, it reads year over year that we don't overspend, because we don't. We're not able to overspend this one like we do strategically the other ones, because there isn't closeout coverage. We don't get relief when we overspend. And so we are constantly modifying those service contracts through our provider, our partner agencies to stay within budget. So for July 1st of 25 through June 30th of 26, we will see a 25% reduction from this 3.5 million. And then we'll reassess probably October, November to see what happens federally, and see if then we're able to receive more money from the State Department, and then be able to increase contracts to our partners in the second half of the year.
Commissioner Shattuck-McNally.
Not to be negative, Nancy, but 75% allocation, we just don't know what that looks like when it happens if the state even receives less than that, and will they be asking for anything back, or will they be absorbing in case there are even more significant cuts in some of those areas?
So this is, the challenge with this one is that the state receives this money on the federal fiscal year, and so they have already received the funding
Okay.
through September 30th of this year.
Okay,
So by the time we get to September 30th, we won't be anywhere near halfway spent. So we will have
Okay.
time on our hands, if you will, to decide then how we adjust, if we need to further adjust towards the end of the year.
okay, and you'll kind of keep us, I mean, I've been
Yes,
trying to watch
absolutely.
that, but it's really hard to track things right now, because I've been tracking a different bill. And I've got, a good reminder, I've got to send in my amendments for that one section, but I'm just curious, how we can help support you, maybe more upstream this summer, if we need to reach out to some of our delegation and just send some concerns and with numbers and stories or something. So I just want to think about that proactively if we start seeing some of more warning lights coming on the dashboard. So,
Yes, we will
Okay.
let you know, and we have a Zoom chat channel with Josh Fudge, so we will make sure to put it in there as soon as we hear that there might be cuts. From what I've heard, we might actually get quite a bit of detail today on the
Okay.
reconciliation plans for the budget that will go through Congress, so we'll see probably in the next couple of weeks, and we'll let you know as soon as we hear.
Okay, thank you.
Thank you. Commissioner Cavallo has a question.
I think we can skip.
Yes. Regarding senior or older adult dental services, is it correct that the health district is still the provider? And is the matter, or the question that came up a couple of months ago, that they were considering making those services based on income eligibility, has that matter been clarified or resolved?
It has been clarified. Unfortunately, that service will end June 30th. So for two reasons. One, they are moving to a means testing process at the health district, which is federally prohibited for Older Americans Act. So we would not be able to continue funding them regardless. Their board has made that decision to have all of their services move to means testing or income
Yes, of course.
income eligibility driven. So, but the other piece, that is not a required service for the Office on Aging. And so as we look at how we prioritize services within a 75% budget, that is one that we don't intend to find another provider to take on.
So what will happen to those people who are older adults and require dental services?
So unfortunately, they would have to leverage their existing services through Medicare, which are very few and far between, or try to identify a dentist that provides a sliding scale, try to identify other resources to be able to do that. We won't be able to fund the health district for that service anymore.
Any follow-up or?
I'm left speechless at the moment.
Okay. Commissioner Shattuck McNally.
I just toured the new Sunrise North Center. They've got more dental chairs. Do we know how they're being impacted and whether they'll be able to continue or maybe absorb some? I know there's not that many dental chairs, but Loveland has 2 locations now, so I'm just curious about, have we reached out or know what that looks like and if that's a resource to help folks?
We will find out. They, only the health district is impacted because they're the only contract entity we have today. So, but we will reach out to see if they might be another resource.
Well, I don't know if you've toured that, but it's a pretty phenomenal facility, which they have not built fully out. They still have room for expansion, so would love to connect you if you're interested.
Okay.
So, thanks.
Thank you. Okay. Anything else on older adult services?
Just one question, please. We talked about 75% funding, and I know there are a lot of folks, a lot of organizations that rely on that funding, and so I'm sure notification will go out to them or has gone out to them. Can you send the commissioners a copy of a single example of that communication? Because it's likely that some folks may reach out, not understanding that it's a rule change and not a reduction in funding from us.
Yes, so we are, we're taking a little bit different approach. So largely our providers don't change from year to year, but we are drafting a more formal letter that will come directly from me. And then we're providing talking points to our staff that help to issue the payments and review the invoices. So we can provide all of that to you in the next couple of weeks.
I appreciate that. I think that this work is really important. There's nothing that you all do that doesn't help somebody and isn't supportive of the community. And these providers are very protective of their services, understandably so. And so it's not uncommon for us to run into them out in the community, and having that information would be very helpful.
Yes, absolutely. Okay, so switching for Colorado Works TANF. So this is the allocation that funds TANF entirely. So the largest portion of it goes to the basic cash assistance or the monthly cash payments that eligible households receive. And then our staff that are required to provide case management and help them navigate barriers and find ways to increase income. And then there is the allowance to provide supportive services or emergency assistance to TANF recipients. Unfortunately, we discontinued all supportive services or emergency assistance almost 18 months ago now because of budget constraints. So House Bill 22-1259 that I've covered there at the bottom, just a reminder, that was the legislation that is significantly increasing basic cash assistance. It was covered initially by ARPA. The ARPA money has now run out, and so for us, just this fiscal year alone, it was about $350,000 that we had to absorb into our existing allocation, which is what is driving entirely the $111,000 that will be overspent. So we will have to cover about $111,000 from TANF reserves. The worry is that we have reduced all discretionary spending that we can, and we have another COLA increase, cost of living adjustment that's going through the state board process now, that will increase basic cash assistance again, I think by about 5%, that we will again have to absorb even more next year. So just continuing to chip away at our TANF reserves year over year, which is why the work of the Works Allocation Committee is going to be really crucial.
Questions? Yeah, so in the recommendations that we had, we were saying that maybe we could freeze those COLA increases, and that wasn't accepted by the JBC. So that's what the Works Allocation Committee recommended. Do you have any, what was the thought process there? Because, I mean, clearly, we're going to be able to serve fewer people, and this is not an entitlement program, so we really will serve fewer people.
So the state statute has made this an entitlement program, is what we have learned through our legal research with county attorney's office. The feds do not consider this an entitlement program at all, but state statute has made it an entitlement program for all households that qualify, single-parent households, two-parent households. So we have that legal research that we're working through that we will provide to you here in the next couple of weeks, but it will take a statutory change to change that. The JBC did not make any decisions, really because they couldn't come to a unanimous agreement, which is what would be required through the JBC. So House Bill 1279 that I covered a little bit ago will be really crucial to show where we're spending money and how we're spending money. But there was also a fantastic presentation that Hannah and I think others on our team sat in on late last week that shows the biggest impact in TANF is actually the supportive services. 50% of people on TANF need transportation assistance to get to work. In Larimer County, when we don't have the flexibility in our budget, we can't provide transportation services. So there is some research coming out too that I think will help make a different case into the future.
That's good, and that could potentially help make the case of whether this is an entitlement then at the state level. I mean, do you think that there's support amongst the counties for pushing back on that?
Amongst the
requirement?
counties, yes, very much so. I think the alignment with CDHS is the challenge.
Okay. I mean, it's just that, there's only so many reserves, and then you're, and then how do you fund this program?
And not to get too far in the weeds, but from 1259, there is a clause in there that if a county's TANF reserves fall below 15% of their annual allocation, the state has to backfill the county. We will be below 15% this year. So we will be one of the few counties that gets to pilot that process because there isn't a process outlined. They'd sent a draft out to the committee members. They're developing that process now, so we'll be amongst one of the first counties to figure out what it looks like.
Right, and then the state reserves start getting tapped, and
Yes.
then so, at some point, maybe the state has to look at some kind of changes.
They will have
because
to.
It's not sustainable, okay.
Based on our projections, state and county reserves will be below the minimum required
years?
amount by the end of '26.
Ooh,
The
okay,
state says by the end of '27, but
but we think it's sooner.
it's
Okay.
faster.
All right.
So moving on to county administration. So again, this is food assistance, county admin funding rolled in with Medicaid funding. we are only able to pay for the staff that determine eligibility. There is no flexibility really in this funding at all. It pays for our eligibility staff, our lobby staff for a portion of theirs. Most of what comes into our lobby is related to public benefits. And so this is very restrictive. The piece that I would love, and maybe we put this back on an agenda in August, about 600,000 of our allocation is paid to Equifax for the work number. So we are required to verify income for individuals coming to apply. And the only vendor in the country is Equifax. And so CDHS has a contract with Equifax, and then Equifax has contracts with most employers in the country. And so there is this, what seems to me to be an inherent conflict, that we're working through the contract with Equifax for next year. They are demanding that the state of Colorado, counties and HCPF and CDHS pays $15 to $25 million to Equifax just in the next state fiscal year, or they increase our rates by 25%. If we can't guarantee, they wanted us to have 1.2 million hits to their service or income verifications. And what we are projecting is that the state as a whole will only have 800,000 hits. So they wanted to increase the rates by more than $10 million just to Colorado. The problem is, because we've had a lot of conversation about, we could be spending $600,000 in a very different way if we didn't have this requirement. But if we were to do it manually, what we've learned is that there is most employers have a no-compete clause with Equifax. And so if we were to reach out to the employer directly, the employer says to us, I'm not allowed to share that information with anyone except Equifax. So it is millions of dollars that we are having to spend from county administrative funding, which is already significantly underfunded, and Equifax just keeps ratcheting it up more and more, and it is a national issue. There are 4 states that are renegotiating contracts now. So we have flagged this for our national associations who are meeting with Food and Nutritional Services, F&S, at the federal level in a couple of weeks, and we have asked the State Department to help us figure out a backup plan and an advocacy strategy by September. Because if Medicaid work requirements come into play, it will significantly increase the cost that we are having to pay. Larimer County would easily pay over $1 million a year just to Equifax, just to verify someone's income to keep them on the program. So it is a much bigger issue, and really a much bigger legal issue. So more to come on that, and happy to have conversations offline too if we want to figure out next steps to address it further. But so we are currently projected to be about $675,000 overspent towards the administration, and that will be covered by our fund balance. There isn't a sort of another pot that we tap into. We have to cover it from fund balance, and we will have to see. The state as a whole is $50 million overspent, so it is very unlikely that we would be covered by other counties. And we are actually the least amount overspent of the large 11 counties. And every single month, our timeliness and quality scores are the highest. So Vanessa's team is doing a tremendous job. The goal for timeliness is 95% of all applications will be processed timely, and we are well over 97% every month, to the point where some of our staff are actually working overtime for other big counties to try to help them dig out, so that the state as a whole is not sanctioned. So just fantastic work from Vanessa's team, and really tremendous tremendous work from the staff that are issuing these benefits.
Commissioner Shattuck McNally.
Well, first I have to say, wow. Thank you. Sorry, Justine. Wow, well done, outstanding, just stunning numbers. And thank you to all the staff who are going way above and beyond to help other counties, but we don't want Colorado to be sanctioned. So 2 questions with that. First, I don't hear this happening in some of our county commissioner meetings. Do we need to be talking about this overall with just Colorado, maybe just all the departments and how we're trying to help the whole state not be in doo-doo? And then also, this Equifax thing, that sounds like a pretty heavy lift, but is that something that we have even shine a little light on with other counties or other conversations? Because I don't think I've heard this in our CCI meetings or CCAT, and that since we're having a lot of conversations about what we can do for unfunded mandates or things that are costing us, I'm wondering if this needed to be added to some of the list for conversations. I'm just curious. Or is this a hot potato or something we need to have a strategic way to approach this? 3 questions, I guess.
So the contract negotiations have just really evolved over the last week because counties have continued to say to the state, we're not paying that. We can't pay it. We won't continue with the contract. And so the state has gone back because it's a state contract. CDHS holds the contract and then they just bill us for our utilization. And so we did flag this for Katie First, the CCI staff member who returned from leave last week. So we have flagged this for CCI and starting to think about bigger strategies to address it. But we do have to commit to next year's contract while we watch it really, really closely to make sure that we're not overspending and that if there are Medicaid work requirements that come this fall, then we'll have to renegotiate an entirely new contract.
Okay, thank you.
So the next couple of slides, this one we've included here that has the benefit amount so that you can see that, but I'd like Vanessa to actually cover this one because it continues to have staggering increases quarter over quarter.
Yeah, thanks. Vanessa Fuel, Division Manager, Benefits and Community Support. So the headline here really is that we have continued to see a steady increase in our food assistance caseload. So if you're looking at Q1 of '24, we were at 18,145 cases. So these are cases, households, not individual people. And then in Q1 of 2025, we were at 19,075 cases. So an increase of almost 1,000 cases. We've seen that number level off a little bit here in the first quarter of the year, but we continue to watch this really closely. And then with our other program areas, we've seen some increase in our cash assistance program areas. Pretty steady from the previous quarter, but if you're looking at this time last year, a pretty significant increase in our cash assistance caseloads there. And if you kind of compare this to the benefits issuance, you can see the more people we have, the more money we have going out into households. And then as those costs per household increase, that's the other data point that we attribute then to the number of benefits, the amount of benefits going into households. If those basic cash assistance households get a 5% increase each year, then you see that in the issuance amount, even if the caseload doesn't change all that much. And then our child support caseload tends to stay pretty flat, but I don't think we have the collections data here this time around, but just a note that the first quarter of the year tends to be a pretty good quarter for child support collections because of the tax intercepts that they receive.
Just one piece on the food assistance. So as Vanessa said, it's almost 1,000 caseload increase from Q1 of '24 to Q1 of '25. Q1 of 2020 was 12,500. So when we go back 5 years prior to the pandemic, that's where you really see the significant caseload. With the same number of staff, we have seen a significant increase, though, in our allocation. So that's where we've worked really closely with HR to compensate them differently and classify the jobs differently. But almost 7,000 caseload increase over the last 5 years.
How many people how many extra staff members does that include? It sounds like, first of all, yes, you are very efficient, clearly, and good at your job, and as is your staff, because, you have all these remarkable numbers and you're helping others even, but what does that mean? How many more FTEs are we talking about with that kind of increase, or any? None?
It hasn't changed
Holy moly.
all that dramatically in that time. We are constantly evaluating our business processes to optimize as much as we can. So we did make some changes in the processing of what happens when that application comes in. We've got a team of folks that start that application and get it ready. So we've optimized our highly trained, very technical staff so they can focus just on those tasks that require their level of training. And then we peeled away all the other tasks around them and created spaces for those tasks in other teams. That's been a huge shift for us. We also have changed a number of our processing tools that we have, our workflow management tool, our appointment scheduling tools. Those tools that support our business processes then have really helped us to streamline.
That's amazing.
It is one of the teams, though, that we are continuing to work through, and I would say the team where we are most closely using the science of hope. In order to work through this many applications, and some of these applications have to be processed in 7 days, some of them have 30 days. And so in order to manage this significant amount of caseload increase, we are Vanessa sets daily metrics for staff. If you're on an applications team, you have to work 7 applications each day. It's a challenge because we want to treat this team as a fantastic team of professionals, but when we're having to micromanage the tasks to that level of detail, it doesn't feel like they're being treated like professionals, is what we often hear, right? I don't have my tasks managed daily by my supervisor. I certainly don't do that for my team, right? I trust them to get the job done. But in order to work through this significant amount of caseload, we have to manage it day to day. And so we're continuing to really hone in on the cultural pieces and make sure that staff understand why we're having to manage it to that level of detail. But it is a team that they struggle and often feel frustrated by that level of oversight too. So just an ongoing discussion, and Vanessa continues that through her Science of Hope committee to see how we can change it day to day.
Well, please pass on that we really appreciate what they're doing, and it is valuable to our organization. Extremely.
Absolutely. Well, thank you for that.
Thank you. Okay, so this is a new data slide that we've included. I think the last time we were before you was the first time, so I'll have Jill walk through this one quickly to show you what's coming into the lobbies.
Yep, so this is our Welcome Center traffic. So you can see there's 3 separate lines. The green is Blue Spruce, the maroon color is Midpoint, and then the yellow color is our Loveland office. So we continue to see the main reason for people visiting to be general questions or to drop off documents for applications or current benefits that they're on. And general questions could be really why they didn't qualify for something, or what is included in the benefits that they currently have, or even just to get resources for other areas in town. I'll note that it doesn't total the numbers, but I was doing some totaling. So in Q1 of just this year, we saw over 10,000 people at all of our locations combined. So continue to see, people coming in. And our Midpoint office, as you can see, is ticking back up, which is our newest location. It's been open about 1.5 years, I would say. So we're seeing the traffic pick up there as well as people learn that location's there.
And again, another reason why my friend Ben will be really crucial in those lobbies too. Okay, so our community outreach and access team. So this is the team that 3 of them were formerly on our child prevention team under Deb DeLuca Forsley. And we, with your support, have continued with 3 of them. So we greatly appreciate that. And we have paired this together with our community services block grant program, which is 100% funded by state and federal funding. There isn't any county match that goes into the 362,000. And we are utilizing that for emergency resources, supportive services, similar to how we would pay for it out of TANF. So we're able to use some of this funding to help offset the TANF constraints. And then we've coupled this together with our SNAP Food Assistance Access Grant. However, we have decided not to continue with our SNAP Access Grant. Because it has been, for 2 reasons. One, we think it is very likely it's going to be cut by the federal office because we wrote it on increasing access and outreach to outer-lying, underserved areas of our community. And so very similar services at the federal level have been cut. And it has been just increasingly difficult to be reimbursed for costs that we've had to that so far. And so we were ready to purchase a mobile office. That's really what the majority of the grant was going to pay for. That mobile office wouldn't be ready from Fleet for probably the next year. And it's too risky to commit to that expense and then not know if we're going to be reimbursed in the federal funding this time next year. So we're not going to continue with the $653,000 in the SNAP grant, but our approach is not going to change. We'll use fleet vehicles, we'll use staff, this team will still go out to outer lying areas of the county with My Friend Ben, with other resources. It just won't be in a mobile office type setup. They'll co-locate with different community partners where we're utilizing their space. So the approach is not going to change, but it just is not smart right now to make that purchase and just hope that we get reimbursed when really all of the tea leaves say we won't get reimbursed. I'm surprised actually it hasn't been cut yet.
I'd like to add here, this was a really tough decision for them to make. There was a lot of analysis that went in, a lot of wringing of hands and considering. But when you think about living within our means, being good stewards, this is one of those cases where it would be ideal to have a mobile office, but the workarounds will continue. The creative approach will continue to still get out in those rural areas. We just won't have a mobile office to do it. And I appreciate the thoughtfulness that went into that decision. I know it wasn't easy because that was a great thing to be awarded, and it had a lot of community outreach opportunities. So we're not giving up on it. It's not gone. The specs are still existing, and if funding comes back, we might revisit this. But at this point, I really appreciate the approach.
Thank you, Lorenda. So we'll rework this budget. Actually, we did not include the SNAP grant in that budget table there. Okay, so childcare assistance, so we continue on a freeze. We've been on a freeze now for 15 months. And you can see the bottom line there on the table. The visual shows you how many families are on that freeze list. So we have 500 families waiting to be served through CCAP, which is heartbreaking. And we anticipate actually breaking even. So we've seen a really significant reduction in expenditures from the freeze. When we went on a freeze, we were projected to be $3.5 million overspent. And unfortunately, we have seen us come into line with budget, but we will have to remain on a freeze because of the new requirements coming, and there is another round of significant provider increases coming in October that we will have to absorb into this allocation. So no changes for the time being, but we do watch it month over month. If we were to shift, we would come back before you to talk about moving to a wait list. The challenge with moving from a freeze to a wait list is that then there are 3 required populations we have to serve on a wait list that would bypass the wait list. So we're trying to analyze what the impact of that would be, how many families that would be that would come on the program and not go on the wait list. And then we'll come back to you with that information. We will see a increase in our allocation, but again, our county match will also increase. So our allocation will be higher next year, with our match being higher. And then again, new provider rates go into effect October 1st. Okay. Child support, so here we have the collection data that Vanessa referenced. This program is similar to the Office on Aging in that we don't overspend it, but it is also 66% funded with federal funding and 34% county match. So this is our highest county match across the board. There is no state funding that goes into this program. And it's also not an allocation. If we had unlimited county resources, we could spend as much as we want and we would get 66% reimbursed. So it's a reimbursement model as opposed to an allocation model. But we budget to our county resources and then just monitor it throughout the year. But this is, it pays entirely for our staff as well to then collect the child support funding. All right, child welfare. So there are several slides on here that I'm gonna skip through because this one really is the most important. So child welfare has 3 allocations that roll up to what's called the block. So our core services allocation pays for services and is only state and county funding. Our child welfare staffing allocation pays for only staff. Both of those, when we overspend, that overspending transfers to the block, which is our administrative allocation. So our allocation total is 26.6 million. Our county match is almost 4.7 million for that. And there are different percentages of the match that I've included on the prior slides, but our projected spending is 30.4 million. So we are 4 million, projected to be almost 4 million overspent for a variety of reasons. And the total, so we're watching the closeout process. We do believe that some of this will be covered. But in total, the 3.8 million, if there is no coverage at the state level, we would have to cover. 10% of our TANF reserves can go to child welfare, so we would, let me look, I thought I had, so 10% of, so about 750,000 would come from TANF reserves. We have about 650,000 in deferred revenue, which are some state fees that we received 10 to 15 years ago that we've been keeping in deferred revenue, and then the rest would come from fund balance. So we will certainly update you as the end of the year comes to a close as we track it. There will be some coverage in core services because there's about 5 million underspending, but we do anticipate a pretty significant portion having to come from fund balance. The reason, so child welfare pays for our staff and our administrative cost, it pays for the services, and then we also have to pay for foster care and adoption subsidies. So all of those things come out of the same budget. We are seeing, so we've reduced services as much as we can in the discretionary areas where we can. What I worry about most, what keeps me up at night, is that we are seeing a significant increase in our foster care placements as we reduce services. So this graph is one that we've brought to you for quite some time now. Larimer County, so that top pie chart shows the green number of, the percentage of kids we're serving in their home that we don't take custody of, but there's a child welfare concern. And then the maroon is our out-of-home placements. So this was through March. There is a lag in the data because we have 60 days to work it. So so you can see that historically we have always had far more kids being served in their home compared to the large 11. Thad Paul, who's out today, but he looked at this data just last week, and that has shifted. We have 35% of our kids in out-of-home care and 65% now in in-home. Still ahead of the other large counties, but as we cut services to try to come closer to our allocation, we are seeing the uptick then in foster care placements. So we're tracking it really closely. We have, the other piece to that is we've lost the prevention grant. And so the prevention grant also had funding that was dedicated to do emergency services to the families in addition to the team. So there are multiple pieces happening at once, but we are seeing a pretty significant increase in our out-of-home placements that we're continuing to track very closely. Here you can see that mustard line on the top are the services that have been issued through child welfare. So you can see those, the significant reduction in services. There has also been a caseload reduction. And so we have actually eliminated 19 positions in child welfare because the caseloads, we adjust the staffing based on the caseloads. So we've reduced the positions by 19 in this team, in addition to the service reductions. And so we're being much more intentional to, we used to provide, I would say, a broader suite of services to families, and now we're being much more targeted and intentional at what services they get, while they continue to work with the caseworker that's assigned to them. This does not yet show the cut in the prevention services, because that's, that will show up in the data for the next quarter. So that's not shown here, so you'll see another significant reduction in those child welfare services. And then this just shows the different types of cases and services. So you can see so that green line that goes from 679 to 372 is the prevention caseload. The reason that's reduced so significantly is when that grant ended. But that will drop a little bit more as we are using some block funding for prevention services that we're not able to sustain.
Heather, are you all tracking outcomes? I know these things have just happened, but you have your outcome data from before, and you'll show your outcome data going forward. Will that have any bearing, do you think, on state funding or any of the federal discussions we'll be having? I know certainly locally we're very concerned about that. I know your staff is extremely concerned about that.
So we are tracking it. And how it looks for us is we track the percentage of families that become re-involved a year later. And so it will take us some time to track in alignment with these same time periods. And then the state reviews that, and it certainly will be part of the conversation. I think we will have to continue to tell the story because we have been so far ahead of those goal measures anyways, because of the great practice we've had for decades, that it will have to share the nuance in the stories that we tell because it won't immediately show up in our metrics. There will be a reduction, but we'll still be meeting the federal measures. So we'll continue to share that with you as we track it.
Great. We're almost out of time. Are we okay to go over a few minutes? Or folks, anybody have anything pressing?
I have 12 o'clock, but I think it's with some of the folks in this room, so,
Okay.
but I don't want to crowd that.
Sure. Okay, so whatever you think is best for the
This
next
is the
couple
last slide I think I'll cover.
Okay.
So I put all of this together on one slide for you so you can see where we will cover what from what pot of funding as we look towards the end of the state fiscal year. So the top is TANF will likely be 112,000 over. Child welfare is the overage. And then in that right column, you can see what we plan to cover from TANF reserves that will deplete our TANF reserves to just about $1 million. We are able to have about 2.7 million in TANF reserves. That's the cap of the maximum amount. So just continued reduction in TANF reserves. And then in the bottom bar there is anything that's left over that we can't cover from TANF reserves, then shows you the impact to our fund balance. So child welfare, we will completely deplete deferred revenue. So we'll cover another 650,000 from child welfare to deplete our deferred revenue. And then everything there on the right is what will hit our fund balance. So our fund balance will go from about 12.4 million to 8.7 million in fund balance, which is about 6 weeks of expenditures. So we will keep you updated just as these evolve and we work through the closeout process that Ann Smith works through to reconcile through July. So we will definitely have updates on this when we come back in August.
Thank you.
Just real quick, Madam
ahead.
Chair. This is exactly what I was, the back of my mind, I was going to ask you offline to kind of put this all into one chart so we could kind of, track it. So if we can maybe get this updated as we know those are changing and stuff. And I just want to say really quickly, wow, thank you. You guys have done such great work and still trying to navigate all these uncertain waters and pathways. So I just want to commend you all for the teamwork and the work you do. It's so important and my heartfelt gratitude. Thanks.
Thank
Commissioner
you.
Cavallis, any last words?
You could tell me for me, thank you.
Okay, I'll just say thank you. I know that you're under a lot of pressure and your staff is too. I know that these aren't easy times, so we really appreciate what you're doing and we will, we're all in this together, so please let us know how we can help and advocate because we want to do that as much as possible. I also wanted to I want to mention that Laura Walker, our Human and Economic Health Director, is in the audience, so thank you for being here as well. And Lorinda, any last words?
Thank you. You all do tremendous work for the community, and it's getting harder and harder to do that work. So please give our appreciation to all the staff. Everyone over there does something that supports this work, and it's very much appreciated.
And really supports people in our community who are obviously, struggling. And to see the numbers that have gone up and the numbers, this is work that needs to be done in our community. So we appreciate you being creative in how we can continue to serve people under these sort of mounting issues. So thank you.
Thank you. Thank you all.
With that, it's 12:02 and we are adjourned. Thank you.